It's now time for us to take a look at news stories making headlines around the globe today. Now, This Day and Arise Media Group, in association with notable partners, have donated a treatment and isolation center in Abuja as contribution to the fight against coronavirus in Nigeria. The center is located at the This Day Dome in the Central Business District. It has the capacity for 360 beds, which can be scaled up to 500 beds if the need arises. The partners in the project are the Sahara Foundation, the Coalition Against COVID-19, the African Finance Corporation, and the Chinese Civil Engineering and Construction Company, CCECC, which handled the internal partitioning, amongst other things. The Speaker of the House of Representatives, Honorable Femi Gbajabiamila, and the Governor of the Central Bank of Nigeria, Godwin Emefiele, are amongst top officials who have visited the center ahead of its formal opening next week. Let's take a look.
What I've seen is beyond what I expected to see. We all know the Dome is a landmark in Abuja. We've all been here for weddings, concerts, and different things. And so I expected to see perhaps a makeshift isolation center with the barest minimum of things. But what we've seen here today is like I said, beyond my expectation. It's a comprehensive, well-equipped hospital, about 300-bed isolation center. They've thought about everything, more or less. They've thought about everything. There's an ICU center. There's a receiving point over there. And I hear there are TVs coming for all, even if it's full to capacity, for all 300 patients. This place, anyone here will be comfortable as he wants to be as a patient.
The This Day Dome management for making this facility available, and we would like to seize the opportunity to appeal to other private sector people that mean well for Nigeria, that believe that they have earned something from Nigeria, they have earned some benefits from Nigeria, to please join hands, not only with This Day, but also with the private sector coalition, the COVID, to work together to ensuring that as these cases come on, that we're able to take them on head on, and we solve the problem for the good of Nigeria as well as for the good of Nigeria.
So there we have seen a 360-bed isolation center donated by chairman of This Day newspapers and Arise News Channel and his partners, Prince Nduka Ogbaibena. It can be scaled up to the capacity of 500, and this is the kind of philanthropy that we have to see at this point in time. Doctor, over to you.
Well, let me go from the personal to the general,
and
then try to contextualize it. So I'll start with Prince Nduka Ogbaibena, who is the chairman of This Day and the Arise Media Group, and to commend him for his public spiritedness. And this we should put in proper context. You will recall that the Minister of Health had appealed about a week ago to hotel owners to donate their facilities to the government, for government to be able to address the challenge of the scarcity of bed spaces that the Nigerian government is facing. And many of those hotel owners, they responded that because of the fear of stigmatization, they would not want their premises to be used as quarantine centers for COVID-19. But here you have a different example in the publisher of This Day, who has this Day Dome in Abuja, in a very strategic location, the Central Business District, and which he had been using in the past as an event center, right? So it falls within the same hospitality industry as the hotels. And he has tried to make a difference. He's not talking about stigmatization. He's placing the public interest, the national interest, above business considerations or personal interest. And he has said, okay, come and take my facility, the This Day Dome, and use it as a treatment and isolation center. And then he partnered with others to present this facility, which is now 98% ready, and which is likely to be commissioned next week to the by the federal government. So I think that is an example that is worthy of emulation, and that was the point that the CBN Governor Godwin Emefiele was making, in a sense, by saying that other entrepreneurs should follow this example. That is one. The second part of it is also about the role of the media. I have written and I've said on this program that the media should be supported by the government. And it was very, encouraging to see that yesterday the Minister of Information announced a 2-month license waiver for extraterrestrial broadcast stations in Nigeria. Now, I think that 2 months license waiver, is a bit more. The government could do more. But what we have seen again with this day dome, donated by Prince Obagbena, is a kind of symbiotic relationship that you can have between government and the media. It shows that, look, media owners are not enemies of government. They are also citizens who have an interest in how society turns out. And what This Day and Arise Media Group have done is similar to what we've seen in the United Kingdom with Daily Mail. The Daily Mail, a newspaper house, set up a charity which is called the Mail Force. And under that, they were able to raise money and donate test kits and protective equipment to frontline health workers and to care homes. So, the media, while expecting government to provide support, also has a role to play. And Prince Nduka Obagbena has shown the lead in this regard. Now, as for his partners, Sahara Foundation, the coalition, the private sector coalition known as CACOVID, the CCCEC, the Chinese Construction and Engineering Company, and all the other partners involved in this, including the African Finance Corporation. What they have shown is solidarity around a public cause. And I think that is something, that others should emulate. And that's something that should be encouraged. And it is enheartening to see that in our society, we still have individuals who have bought into the narrative that saving society is not a task that should be left alone to government, and that the war against COVID-19 is a collective responsibility.
Absolutely. And
we look forward to the commissioning of that facility by next week. And with capacity up to about 500 bed spaces, that should help the Presidential Task Force and the Nigerian government generally to address the challenge of lack of bed spaces. And I hope others will contribute by, also contributing other facilities that may be needed at that This Day Treatment and Isolation Center in Abuja.
Certainly, Doctor. I couldn't agree with you more. Once again, thank you to Prince Nduka Obagbena, the chairman of This Day newspapers and, of course, Arise News Channel. Now, in the meantime, the Nigeria Center for Disease Control have confirmed 195 new cases of COVID-19, now bringing the total number of confirmed cases to 3,145. Now, 53 more people were discharged yesterday, bringing the total from 481 to 534 recoveries, while the number of fatalities have also increased, unfortunately, from 98 to 103. So, Doctor, there again is our breakdown with regards to increased cases of COVID-19, 195 new cases, 82 in Lagos, 30 in Kano. And of course, we don't have much time to discuss this. I'll hand over to you now, and hopefully when we come back from a break, we can go into more detail.
And in any case, Aaron will still be here.
Yeah, exactly.
And if any will still come, I guess, with the same topic, there'll still be time to comment on it.
Absolutely. So on that note, we'll take a quick commercial break on the morning show. And when we are back, the conversations for today continue. Stay with us. Welcome back to the morning show here on Arise News. Joining us now for today's business updates is Rota Sodiri, our business analyst. Good morning, Rota. How are you today?
Good morning, Dr. Abasi. Good morning. So it looks like we have another price cuts coming on the way at the pumps. The NNPC sent out a tweet yesterday announcing that the ex-depot price of fuel had been reduced from 113 naira per litre to 108 naira per litre. I should point out to everyone, of course, that this is the ex-depot price. This is what, as the marketer and price leader and sole importer of fuel, refined fuel into the country, this is essentially going to set the way for what we pay at the pump. So this is not the pump price. Just to remind people, the PPPRA, Petroleum Products Pricing Regulatory Agency, already we've done this twice already. So March the 18th, it was revised from 145 naira per litre to 125, and then on April 1st, from 125 naira per litre to 123.50. So we still are waiting to hear from the PPPRA to tell us exactly what the pump price is going to be. I think it was the Vanguard. One of the papers actually took a stab at a guess. Took a guess as to what the price might end up being. It's said that usually the difference between the ex-depot price and what we pay at the pump is about 8-9 naira. So they just mean, again, I'm just emphasizing this is a guess, that'll probably be about 117 to 118 naira per litre. But we will wait for the official word from the PPPRA to see exactly what the price will be. But this is in line with what they announced in the middle of March, that at the beginning of every month, on the 1st, we will get guidance as to what that new price will be. But of course, the 1st of the month was a public holiday, and so that now fed into the weekend. So this is why we're now getting this update. But the implication is, you know, for you and I, everyone else that buys fuel for their generators, for their cars, it's a small boost in consumer disposable income, you know, because you're getting a cut essentially. Yeah. But then there's still the overarching issue of the NNPC still being the sole importer of the product, and you know, it's still an uneven playing field as far as other marketers are concerned. So there's still that issue, but for now, at least we get to pay less.
And that really is a big issue.
Yes, yes.
And I'll get to it in a moment. Now, the first point to be made is that what the NNPC is succeeding in doing is a way of telling Nigerians that, look, oil prices, a pump price of petroleum products or a PMS can go up, can go down, depending on the realities in the global oil market. Yes. Right? That's one. So between March and now, we have had, you know, adjustment. This is the third one, right? Between March 18, when the federal government said, you know, the pricing mechanism for pump price of petrol will be market reflective. Yes. And the NNPC is always ahead because it's the owner of PPMC. Right. NNPC owns PPMC 100%, which is the sole importer of refined product. Yes. And you have NNPC as this big monopoly. It's dominating the upstream. It's in the downstream. It's a retailer. It's a regulator. And that's why I said the big issue is what you've pointed out about the role of the NNPC. Yes. I think it was Nasir Rufai who said that if we don't kill the NNPC will kill us. Yeah. You know, and other stakeholders within the within that sector, you know, have also said, look, we need to do something about the NNPC. So, given a market-reflective pricing regime in line with the PPPRA template, which they were quoting, is one thing. There are certain fundamentals that will need to be addressed. Otherwise, we'll be doing all of these pricing templates at a very superficial level. And you could find a situation later when oil prices go up, right? And Nigerians are required to pay a lot more. Right. And that could have implications. What are those fundamentals that we still need to address? Just a few of them. One, there are persons who have been calling for the privatization of the NNPC. Yes. That the NNPC doesn't have to be, you know, everywhere and be this terrible monopoly that it is. Because in any case, whatever price we're paying for today in terms of deficit and distortions in the Nigerian economy is in part as a result of the NNPC's inefficiency, say perhaps in the last 10 years. Two, the refineries, and NLC has been pushing this point. Our refineries have not been functioning, yes. Right? Now, if those refineries were functioning and we could refine crude here in Nigeria, right, then the argument of the NLC is that perhaps the pump price of petrol may not be more than 60 naira per litre. Right. So telling us that, oh, we will now pay 125, we will now pay 108 is not addressing the major issues. So these are my own concerns at a preliminary level. But NNPC is saying it will help it to sell more volume, reduce its storage and all of that. Yes, the average Nigerian may be happy that he will spend less on petrol. But the truth of the matter is that tomorrow he may have to spend more.
Certainly. What would you say your main concerns are here, though? Well,
see, for the marketers, in order to get them involved, their issue, though, is foreign exchange. Because NNPC is able to, this is an imported refined fuel, which goes to Doctor's point about the refineries being brought up to speed. So if that FX price differential can be sorted out, because the marketers have to be able to sell the product to us, the end users, at a reflective cost of what they brought it in for.
Certainly.
So that is something that is still a clog in the wheel if you think about, deregulating it completely. But quickly to Doctor's points about the refineries, Melekiari, the group managing director of the NNPC, did say that they are going to be letting go of them and letting private sector come in at some point. So it's a good direction.
Certainly is. Reuters, thank you for today's update. We'll see you tomorrow. It's time now for a short break on the morning show. When we are back, we'll be joined by Aaron Akerejola for today's updates with regards to COVID-19. Stay with us. Welcome back to the morning show here on Arise News. Now, before we're joined by Aaron Akerejola for a more global update on COVID-19, let's take a closer look into Nigeria with regards to this, as the federal government have lamented for the second time since Monday's easing of the lockdown on the Federal Capital Territory, Lagos and Ogun states, as the refusal of citizens to comply with its guidelines on the steps to curb the spread of COVID-19, saying that Nigerians were yet to come to terms with the deadly nature of the virus, warning that there were great dangers ahead as the disease might spread exponentially, with the attendance also with the potential, to overwhelm the public health system. Nigeria have recorded 195 new cases on Wednesday, as we stated earlier, bringing our total tally to 3,145 confirmed cases in the country. So, Doctor, here we have the government lamenting that Nigerians are yet to come to terms with the realities of COVID-19, and this is an extremely valid point. Aaron, I guess you'll come into this conversation with us as well, and we can all take a look at this. Doctor?
Well, very quickly, at the briefing yesterday, Boss Mustafa, the chairman of the Presidential Task Force on COVID-19, drew attention to this. And before him, where we had the Minister, Hanere, also expressing concern that people are not observing physical distancing and social distancing, and that in that regard, they are placing themselves at risk.
Certainly.
But the bigger concern that was also expressed yesterday was about interstate travel.
Yep.
Now, when the easing of the lockdown was announced, exemption was made for the transportation of food products and pharmaceuticals. That exemption did not include human cargo.
Exactly.
And what many states governments in the southern part of Nigeria have observed is that, many of these trucks bringing, food products from the northern part of the country always have embedded in them human cargo. And some of them, they have had to turn back to say that, look, these people should be returned to the north. And even in parts of the north, some of the people who were repatriated from Kano to other parts, they were discovered to have been, COVID-19 positive. Yeah. And I think that the responsibility here, as articulated by Boss Mustafa yesterday, is that, one, the security agencies have a lot to do to enforce this interstate movement in the face of this ease of restrictions. And then further, I think there will be a need to talk to the transport unions, the Road Transporter Employers Association of Nigeria, and similar organizations, to make sure that they enforce these guidelines with regard to interstate travel. They must see a need to understand the implications of allowing people to just move up and down and, promoting community transmission.
That's the issue. It's as though they don't see the need. They don't understand the importance of this and the dangers of COVID-19 themselves. And it's because the system is dysfunctional in so many different ways. It's such a multifaceted problem. Poor palliatives, poor everything. You're looking at a society that's not working for the people. So it's really, really hard to find a solution to this problem. Aaron, how do you react?
No, it's been outlined, and actually been put on the table. And right now we know that all infrastructures in terms of how to respond to this has been stretched to the limit. But at the same time, it's also highlighted the fact that as it stands, we've been seeing a lot of vacuum. And this is where we need efficiency to actually come and shine through. And the lack of efficiency in most of our sectors is being actually brought to the bear. And if we don't do something, this would actually spiral out of control, because interstate travel, the lockdown on interstate travel should be enforced heavily so that people do not just move around and carry this virus from one region of Nigeria to the other.
And you don't want it to get to a point where the government have to enforce a total nationwide lockdown either, because that's what it could come to. But let's take a look as well at the global updates for today before we go. All right,
okay. As it stands right now, of course, the global tally right now for confirmed cases of COVID-19 stands at 3,753,000. 219. That's the confirmed cases. All right, with the death toll right now standing at 263,843. All right, looking at Africa, let's actually chime into Africa. All right, the number of confirmed cases actually stands at 51,698, with 2,012 deaths, and the recovery rate, we've seen recoveries of 17,590. As it still stands, both the Northern and Western Africa actually share the bulk of the confirmed cases in Africa, with South Africa still leading. And at the moment, South Africa are actually turning to any measure to see how they can help those victims and help those that have confirmed cases, because right now they are actually trying to pally up with Madagascar in saying how alternative medicine might be the way out to help those who have actually recorded or who have actually gone down with the coronavirus. At the moment, South Africa has 7,808 confirmed cases, followed by Egypt with 7,588, then Algeria with 4,997, and Nigeria coming in fifth with 3,145, like you rightly said earlier on. Ghana's case has also, the number of confirmed cases in Ghana has also risen. Ghana now has 3,091 cases. So we're seeing these things actually go up. But at the moment, it still stands that Egypt and Algeria do have the highest number of death tolls from COVID-19 in Africa.
And we still have not reached our peak, and that's the unfortunate truth.
Yes, it's an unfortunate thing, but quickly, internationally, in Ecuador, the death toll rate has reached about 15,000.
Yes, which
Tragic.
is
confirming, the worst fears. And, when Melinda Gates drew attention to what was happening in Ecuador and compared it to what will happen in Africa, many Africans got very emotional. I just hope that, African countries will move very quickly enough and more deliberately enough to make sure that no African country finds itself in the kind of situation in which Ecuador has found itself. Now, in the U.S., within 24 hours, the number of the number of deaths also went up, compelling President Trump to accuse China of the worst attack ever in history. And I think that, now that he has seen that the easing of restrictions may not be something you can just decide on without plan, it probably will also be compelled to moderate his rhetoric. In the United Kingdom, by Sunday, the Prime Minister is going to announce, a five-part plan of how to ease restrictions beginning from Monday, May 11. And the government of the United Kingdom may change its narrative from stay at home to go to work, but make sure that you are safe. But there are other sides to it. On one side, certain restrictions will be eased. On the other side, certain restrictions will be tightened, like border checks into the United Kingdom, and the decision to quarantine anybody that comes into the United Kingdom. In Germany, the football season is likely to reopen by the end of the month.
Yeah, towards the end of the month.
And shops are reopening. But anyway, thank you very much.
All right,
Thanks,
so it was a pleasure.
Aaron.
It was a
See
pleasure.
you tomorrow.